My name is Eudora Savage, and I'm here reporting for our Health Matters magazine. And I will be interviewing Dr. Leslie Fields today.
Thank you.
And tell me about your medical profession and how you're involved with the National Medical Association.
Okay. Well, first, my name is Dr. Leslie Fields. I am the president of the Greater Kansas City Medical Society, which is kind of like the Kansas City chapter of the NMA. I've been involved probably for the past 3, maybe 4 years, and it's just a great, collection of brilliant scientists and doctors and people who have all varied levels of experience. So it's been a great experience to be involved with NMA on a local level.
Awesome. So, what role does the National Medical Association play in helping you in your profession?
Well, I think, number one, just having a group of people who subspecialize but know kind of some of the intricacies of African American communities and Black and brown communities in general, and some of the subtle nuances that are different in our communities. I think it's important to have a group of people who subspecialize that you can call on, and oftentimes the National Medical Society is where you find that, those subspecialists, because we're not always plugged in on a local level. So sometimes you might be practicing with a cardiologist, a GI doctor, all kinds of specialties, and not even know it in the same city and not even know it.
Awesome. So, what are your goals for the local chapter of NMA?
Well, our most important goal is to kind of recapture people on all different levels of activity and experience. So we basically want, we don't want to take up a lot of people's times, but what we want is, people who are interested in advocacy to have an opportunity to volunteer,
Right.
people who are interested in mentorship, people who are interested in medical education, people who don't necessarily want to go to a meeting every month but want to participate on that kind of level. What we want to do is make sure that folks have that opportunity to volunteer.
Awesome. I've heard there is a shortage of minority doctors. What do you believe limits some minority students from pursuing a career as a doctor?
I think there are a lot of things. I think length of training is probably one of the biggest things. You have to be okay with having delayed gratification. It takes 4 years of undergrad. I took 4 years of medical school. Everybody takes 4 years of medical school except for the people who are in a combined program. And then you take another, part of your training, whatever you do for training. So I did 4 years for training, and I did a med peds residency. So for a lot of, people, that length of training is just too much. It's too much to kind of capture somebody's attention on one particular area. So I think that is sometimes an obstacle. I think just having the exposure to know this is something that you can do. One of the people who came, his name is Gary Watkins. He's an ophthalmologist in St. Louis, but I knew him because we were all in Jack and Jill together. And even though I didn't have doctors in my family, I saw people, brown faces, that were physicians. And a lot of times, I will get patients that will come up to me and just say, I've never had a Black doctor before. And so I think sometimes it's also a matter of just being able to, think that you can do it, that this is for you. And so I think for a lot of our young students, they don't see that as often, and they just don't consider medicine as being an opportunity that they can take part of.
Awesome. Now, what more would you like to share with the community?
What more would I like to share with the community? Oh, there's so much. I think if there was one specific message around health, it would be that your health is yours, and that it should be something that you cherish. You should know your medicines. You should know your doctors. You should know the things that make you have whatever disease process that is, and you should take ownership over it. And the reality is, you are a person with diabetes. You're not a diabetic. You are not a person, that is only limited by that. So, it's yours to take charge of and to hopefully defeat,
Absolutely.
hopefully have very good control. But that's the thing is, it's about people taking ownership It's not about doctors making you healthier.
Thank you so much for joining us.
You're
Enjoy
very
the
welcome.
rest of your conference.
Thank you.
My pleasure.
Thank you.